Yeah, it's a pleasure to be here, and I'm delighted I was invited to be part of this particular roundtable. I'm going to, as Jerry mentioned, provide a brief overview and talk a little about the impacts of caregiving. And as a caveat, let me say that my interests have primarily been with caregiving for older adults. So the databases that I use, such as the NHATS, which is a representative sample of older adults, or the NSOC, which is the linked caregiver sample to the NHATS, focuses on caregiving for older adults. Many of these conclusions would apply to other populations of caregivers, but keep that cautionary note in mind. Okay, so very briefly, and I feel like a little bit like I'm preaching to the choir, there are many caregivers in this country. Just looking at caregivers for older adults, we're looking at approximately 18 million individuals. The economic value, and there are various numbers out there. A conservative estimate is about $234 billion in 2011. And as most of you know, there's this growing gap between the need and desire for family care and its availability. And this is going to get worse for a variety of reasons as we move into the future. There are many adverse impacts, and I'll talk a little bit more about that in a moment. So, caregivers have always been, family members have always provided care for their relatives. It's nothing new. What's changed is the duration and intensity of caregiving and the complexity of the kinds of tasks they now carry out, as opposed to 10, 20, or 30 years ago. They're doing a lot of complex healthcare services that in the past might have been provided by a professional nurse. And importantly, they're doing many of these things without adequate training or support to carry out these tasks, or even assessing their ability that they can do them. So these are large deficiencies in our system that need to be addressed. The impact of caregiving is highly variable, and we shouldn't lose sight of the fact that there are many positive aspects to the caregiving experience. People report that they're really making a difference in somebody else's life, and I think there's almost nothing as reinforcing as that, as being able to improve or maintain the quality of life of someone that's close to you. However, it also leads to a lot of negative impacts, such as emotional distress, depression, anxiety, and other psychiatric issues. If you want to understand what affects caregivers, a very simple calculation is to simply look at the intensity and duration of care provided, measured in terms of hours or any other kind of related metric, and you would find the greater the amount of care, the greater the distress. And along with that, there are a whole host of other risk factors, which includes like low SES, high levels of perceived suffering of the recipient, which is an issue I think doesn't receive enough attention, living with the care recipient, lack of choice in taking on the caregiving role, lack of support, and a physical home environment that's not conducive to providing the type of care needed. There are also financial risks. People lose Social Security and other retirement benefits. They forego advancement in their jobs as a result of taking on the role. They spend a lot of money out of pocket to support the person they're caring for. And those most vulnerable are women, those with low income, persons who live with or far away from the care recipient, and those with limited work flexibility. Okay, caregiving is a longitudinal experience, and this is an illustration of the graphic, simple illustration of what a caregiving experience might be like for an older adult. It begins typically with sporadic care, grows to include providing IADL and then ultimately ADL assistance, placement in a long-term care facility sometimes, and ultimately death. Important to note a couple of things. The tasks that you're asked to do are cumulative over time. It's not a discrete set of things you do. You start out with taking your relative to a physician, you're checking or monitoring medical conditions, and then you add on to that as the person deteriorates, requires more support and care. until you get to these middle or late stages of a caregiving experience, which are extremely intensive and extremely demanding. And it's at that stage where you see these many negative health consequences associated with caregiving. Okay, well, one of the things we became interested in, this brings us to the topic of serious illness. There are many ways to define serious illness. We chose, using the NHATS data, to define three populations: care recipients with dementia, those who are at end of life, meaning they're going to die within a year, and those who have 3 or more chronic illnesses. And you can see the population estimates among older adults illustrated here. So, for example, there are 1.7 million dementia patients, 440,000 end of life, and so on. You can also, though, interestingly, look at the intersection of those conditions. There are some caregivers who have to deal not only with end of life or with dementia, but dementia and end of life and chronic disease. And that poses challenges that are even more intense than those that you might imagine occur with individuals caring for persons with within one of those categories. So if you look at that very central three-way interaction, in the very middle, we have about 290,000 older adults who meet all three of those criteria, and 97% of those individuals have a family caregiver. So as the intensity of the problems increase, the probability of having a caregiver involved also increases. So if you look at these high need, high cost patient and how they affect the caregiver, they demand more hours of care, as you might imagine. Caregivers are involved in providing more different types of tasks. They have higher psychological and physical morbidity, and there's increased financial strain associated with caring for those high cost, high need populations. There's also a consequence for the care recipient in this context, looking at those same populations. For those high need and high cost patients indicated in the bars in red, you'll see that if you look at any one of those comparisons with respect to unmet needs, the high need, high cost patients have more unmet needs with respect to ADL activities, mobility activities, and any unmet needs. And those last two bars shows that about 55% of care recipients in that category have unmet needs. And then the question is, what are the consequences of those unmet needs? And here are some examples. So for persons with chronic conditions, they're likely to have wet or soiled clothing, to go without bathing. They're not getting dressed. They're having to stay in bed, stay inside. They have limited mobility, go without hot meals. If you look at the dementia population, you're looking at consequences such as soiled clothing, being bedbound, limited mobility, and so on. So the impact of caring for a high need, high cost patient not only affects the caregiver adversely, it also feeds back to the patient, resulting in negative impacts in that population as well. So I have 30 seconds, and let me leave you with 3 takeaways. One is that caregiver is a longitudinal experience. It changes over time. And if we want to talk about integrating health and long-term care services or support services for caregivers, we need to think about it from a longitudinal perspective, as well as a point-in-time perspective, which is what we currently tend to do. Number 2, not all caregivers need help. Many caregivers do just fine with the challenges that they face. And those needs typically vary by the status of the patient and a host of other factors. And finally, caregiving for the seriously ill poses unique challenges, unique impacts, and they should be given high priority for any kind of policy development. Thank you.